Hello, welcome to the Oracle HCM Cloud Benefits Self-Service Landing Pages. The Self-Service Benefits Landing Pages feature has been recreated in the Redwood Toolset Visual Builder Studio to improve the user experience by providing new functionality for a better employee benefits enrollment experience. The business need for benefits enrollment screen has new updated themes and skins, and also a guided enrollment process, allowing employees to perform quick actions such as change beneficiaries, self-report a life event, use calculators to forecast cost and savings, and many more features. The outcome of this self-service benefits redesign is allowing an enterprise's workforce to enroll into global benefits offerings, review any pending actions, and print their current, past, and future enrollments. Employees can print temporary ID cards, add contacts, complete pending action items, change beneficiaries, and seek support through the benefits representative. We will walk through the employee self-service landing pages. This demo will guide you through the key features and functionalities available on the landing page for self-service benefits. Under the navigator on the left-hand side, users will select on Me, Benefits. Here I have logged in as an employee and navigated to the Benefits Self-Service Enrollment page. Here I can clearly see an enrollment message displays the enrollment period dates and an option to start enrollment immediately. If the first time the button says enroll now, if already attempted to enroll prior to the button says update enrollment. Scrolling down, I can see the pending action section. This informs the user of any pending actions that were previously triggered based on enrollment selections. Below that, I have the enrollment summary. I can choose the current enrollment or benefits as of a date. And note the program selection here if I had multiple programs. Clicking on View All Enrollments, I have the same capabilities, the current enrollment or as of date. Displayed on the right-hand side is the total cost per pay period, pre-tax, after-tax, and annual cost. Below that, I have my enrollments and their badges and amounts and coverages and dependents and beneficiaries that I've elected. You can see the badges per the row, interim, suspended, opted out, for example, and also automatics. Scrolling back up, I can click on the Print All Benefits. This renders a new tab. The new tab will render the benefits confirmation and summary report, displays the user's name, their employee number, and their currently expended interim coverages and benefit selections. Scrolling down, I can also see the cover dependents, any primary care physicians, and any beneficiaries. I can download this or print this. I will close this tab and return back to the enrollment summary page. Hitting the back button, I am taking back to the landing page for self-service, and I can see the 4 plans that are listed under the plan option sequence for the program. A quick access list on the right top side of the page. Actions are sorted alphabetically. Click on before you enroll. Employees can add a new contact or can edit an existing contact. Click arrow to go back to the landing page. Click Dependent Care FSA Calculator. If implemented, users can select their tax year, enter an annual income, and estimated tax rate. With this data, users can enter categorical expenses that they may incur throughout the tax year to help estimate the dependent cost. Upon entry, users can visually see their potential tax savings and suggested annual contribution amounts. Users can alter amounts in any of the data entry to recalculate at any time. Once done, click top left arrow to go back to the landing page. Enter $100,000 for annual income, estimated tax rate 10%, and 100 for each of the categories below. Note the potential tax savings and suggested annual contribution. Click the back arrow to go back to the landing page. After closing the Dependent Care FSL calculator, users can enter document records. The new Documents of Record page renders wherein the employee can select the document type and attach it or enter a URL. Once I've completed my updates, users click Submit. Once completed, users can edit, add more, or navigate back to the landing page. In this sample, we have a marriage certificate and a birth certificate, and I can add a new. Select Healthcare FSA Calculator. If implemented, users can select their tax year, enter an annual income and estimated tax rate. With this data, users can enter categorically expenses that they may incur throughout the tax year to help estimate their own cost. Upon entry, users can visually see their potential tax savings and suggested annual contribution amounts. Users can alter amounts in any of the data entry to recalculate at any time. For example, $100,000 annual income, estimated tax rate 10%. We'll use 100 for each category. Note the potential tax savings and suggested annual contribution in the top right corner. I can hit the back arrow to return to the landing page. Select the HSA calculator. Select your HSA plan type single or family. Tax year, enter a current balance, annual contribution amount, annual medical expenses, contribution period in years, estimated tax rate, and expected rate of return. Upon entry, a graph appears displaying your future value of the HSA dollars and tax savings. 5,000, 100, 100, 10, 15, 8%. Click on off of the table. The graph will render showing the estimated future value, 7822.74, and the estimated tax savings. I can click on the line graph to display a different graph. I'll select the back arrow to return back to the benefits landing page. Click on Report a Life Event. Users can add a life event for themselves, spouse or domestic partner, or my child. For example, when did this life event occur? Today's date. Any comments that I'd like to add. Click Save. Note any auto-approved life events. Click Continue. I can add contacts. In this example, I will continue. And I get a message saying your life event has been auto-approved. You can now change your enrollment in this example. Click Continue. And I'm driven to the self-service enrollment page where I can complete an enrollment. I'll hit the back arrow twice and return to the landing page. Click on Review Employee Resources for any SBD or benefit plan documentation, links, videos, etc. uploaded by your employer. Click on Temporary ID Card. This page allows the employee to review any plans that have been configured with a policy or group number. Employees can print this page and present at a doctor's office, for example. Click back arrow to return to the landing page. Click on Primary Care Physicians. This drawer allows us to click plus add primary care physician. I can select the plan name, TM Medical PPO Insurance. I can type in a doctor's name. Select the specialty, general practitioner, enter a physician ID and a physician contact phone number, and click Save. And I can click X to return to the landing page. Outside of enrollment flow, I'm able to change beneficiaries. During an enrollment window, I'm able to go back to update the enrollment through the enrollment flow and modify beneficiaries as needed. Clicking on beneficiary organizations, I can add a new beneficiary organization or edit an existing one. I'm going to close the X and return to the landing page. Clicking on the last action, person info, I'm able to add new person info or edit existing person info. I've already previously added this. Click X to go back to the landing page. And last, at the bottom of our page is the support tab. This tab will list any resources and again, any areas of responsibility contacts for benefits specifically, and users can add as needed. I'll click back arrow, return back to the landing.